In this video, we will go through the correct step-by-step technique for measuring blood pressure manually, using a sphygmomanometer and stethoscope. This skill is important for safe nursing practice and OSCE preparation. Begin by performing hand hygiene. This is the foundation of all clinical procedures. Prepare the equipment, including the blood pressure cuff, sphygmomanometer, and stethoscope. Introduce yourself to the patient, confirm their identity, explain the procedure, and obtain consent. The patient should be rested and comfortable. Ask them to sit with their back supported and feet flat on the floor. Support the arm at the level of the heart, with the palm facing upward. Correct positioning is vital for accuracy. Remove or adjust any tight clothing from the upper arm to ensure blood flow is not restricted. Select an appropriate cuff size. A cuff that is too small may give a falsely high reading. Wrap the cuff smoothly. Position the lower edge approximately 2.5 to 5 centimeters above the antecubital fossa. Ensure the cuff bladder is positioned directly over the brachial artery for the most accurate measurement. Check the tubing, valve, and gauge before use. Ensure the valve can be tightened and released smoothly. For the two-step method, first estimate the systolic pressure by palpation. Inflate until the pulse is no longer felt. Note the pressure reading where the pulse disappeared, then deflate the cuff completely. Place the stethoscope earpieces in your ears and check that the sounds are clear. Locate the brachial artery and place the diaphragm directly over it. Avoid touching the cuff or clothing. Close the valve and inflate the cuff to 30 millimeters of mercury above your estimated systolic pressure. Slowly release the valve. Allow the pressure to fall at approximately 2 to 3 millimeters per second. Listen carefully for the first Korot cough sound. This point indicates the systolic blood pressure. Continue deflating slowly. The point where the sound disappears indicates the diastolic blood pressure. Deflate the cuff completely, remove it carefully, and ensure the patient is comfortable. Record the blood pressure measurement immediately to prevent errors or omissions in the medical record. Clean your stethoscope and cuff according to infection control requirements before your next use. Report any abnormal findings immediately according to clinical policy to ensure appropriate care. To measure blood pressure accurately, remember to position the patient correctly and use the right cuff size. Support the arm at heart level, deflate the cuff slowly, and document your findings immediately. Thank you for watching. For more clinical skills guides, visit our website or follow our YouTube channel.